common when hypothyroidism become severe. Okay, so allengil untreated aavumbo. What are the situation in which myxedema coma is developed? That is something very important. What are the situation or what are the causes or what are the triggering factors to develop myxedema coma? Okay, appo triggering factors ഓർത്തിരിക്കുക. Why triggering factors are important? Because when you know the triggering factors, you can easily prevent those triggerings. Okay, number one is cold exposure avoid ചെയ്യുക. Okay, already in hypothyroidism cold intolerance is there, so we have to avoid cold exposure. An infection should avoid. Very important to remember is when in an infection, when your body exposed with an infection or നമ്മളുടെ ബോഡിയിൽ ഒരു ഇൻഫെക്ഷൻ എപ്പോഴെങ്കിലും ഉണ്ടാവുമ്പം infection increases the metabolic rate in our body. During infection, my metabolic rate should increase. Okay, എൻ്റെ ബോഡിയിലെ മെറ്റബോളിക് റേറ്റ് നിർബന്ധമായിട്ടും എന്ത് ചെയ്യണം, കൂടണം. എപ്പോഴാ? ഇൻഫെക്ഷൻ ഉണ്ടാവുന്ന ടൈമിൽ. ഓക്കെ, അപ്പൊ എൻ്റെ ബോഡിയിൽ ഇൻഫെക്ഷൻ വരുമ്പോൾ മെറ്റബോളിക് റേറ്റ് കൂടണം. ദാറ്റ് മീൻസ് ഇൻ ഇൻഫെക്ഷൻ T3, T4 and calcitonin, all other hormones production should increase. Clear ആയോ? Okay, so in infection, when patient is diagnosed with hypothyroidism and suddenly when the patient develops infection, the situation may worsen. Clear? And use of certain drugs, that is when using any OTC medications, tranquilizers or morphine, opioid medications, that worsen the condition. And any kind of physical trauma, stroke, heart failure, these are the chronic conditions, and bleeding. Okay, so these are the situations when metabolic rate increases and the hormone requirement will increase. But if you are not replacing the hormone adequately or the condition remain untreated, the condition may move into complicatory conditions like myxedema coma. Clear? So please remember these triggering factors so that you can prevent all of these triggering factors, so patient will not develop any kind of complication.